Greetings, everyone. This is Eric Hong, Executive Director of the Momiji Healthcare Society, speaking to you again on April 8, 2022, about the COVID-19 pandemic. First, the good news. The fifth wave of the COVID-19 pandemic, fueled by the BA.1 Omicron variant since November 2021, has died down, or so we are told. Now the bad news. The sixth wave, fueled by the BA.2 substrand of the Omicron variant, is already upon us. Just as we've recently been told that hospitals are no longer overwhelmed with the growing number of COVID-related admissions, and the number of people requiring intensive care has been dropping since January, those indicator numbers are rising again. Just last Sunday, April 3rd, the number of COVID patients having to be hospitalized increased by 16% from a week ago, while people requiring ICU care for COVID-related issues rose by 6% from a week ago. It has been over 2 years since COVID broke out in Canada, and it is far from over. We are all tired of the lockdowns, restrictions, and public health measures instituted by government meant to keep us safe. We have had to wear a mask at all times, not see our family and friends for long periods, stay 6 feet away from them when we do, avoid public places where there are more than a few people, wash our hands raw with soap and disinfectant, eat out of takeout boxes rather than at restaurants, curtail social and recreational activities, and cope with many more lockdown-related restrictions. We had endured everything in response to the pandemic as a crisis. But how long can we keep on doing so without suffering crisis fatigue? Many of us are physically exhausted, emotionally drained, and tired of worrying. Was it worth it? Consider this. We have had very few instances of infection among our seniors residence tenants. We can count with the fingers on one hand when Momiji staff had had to be isolated. We have not had any outbreak of infection among us at all. That's what all our cooperation and inconvenience have gotten us. Much to be thankful for. While we continue to focus on keeping everyone safe from COVID, we are equally concerned about the psychological, emotional, and social well-being of the Momiji community. We recognize that the need to return living at Momiji to a new normal where everyone can start enjoying life again instead of just surviving the pandemic. We acknowledge that the Momiji community is well protected by a high vaccination rate against COVID-19 and that we have learned to live with the threat of the pandemic by doing the right things. The community at large across Ontario is reopening at the urging of both provincial and municipal governments. Restaurants, theaters, sports venues, shopping malls, and other public places are welcoming people back with very few restrictions. Accordingly, starting in April, Momiji is also gradually bringing back much of its communal, social, and recreational activities. We will also be welcoming back volunteers and community residents onto Momiji premises for the first time in 2 years to take part in programs and services. Government is no longer requiring people to declare the vaccination status in order to enter into public places. However, when entering Momiji, meeting with staff, visiting tenants, or joining in group activities, we are continuing to request that clients, volunteers, and visitors inform us of their vaccination status, participate in symptom and exposure risk screening, maintain physical distancing, practice frequent hand washing, and stay masked while on site. Vaccination and risk screening information collected will be held in the strictest confidence and referenced only in the event of infectious exposure risk or outbreak for contact tracing and to inform visitors of their needing to get tested or treatment as necessary. We will continue to monitor risk of community spread of infection and adjust restrictions accordingly. We have been able to keep everyone safe so far by being careful and cooperating with safety protocols. I ask that everyone be patient for a little longer yet, so that we might continue to maintain a safe haven for all concerned. Thank you.